Our focus as the UPND-led government includes disease prevention, prolonging life, and promoting positive seeking lifestyles. Health determinants are improved if we promote environmental health. In the long run, we reduce on costs as we prevent disease. We reduce hospital-related costs, including the burden of purchasing drugs. Distinguished guests, ladies and gentlemen, we all know that we are at a defining moment in time. Communicable diseases are on the rise. Health emergencies such as COVID-19, Ebola, and many other infectious diseases have been threatening our very existence. There has been re-emerging of infectious diseases like malaria, including the extra burden of mosquitoes, and even infectious diseases we thought never posed a threat are now a threat, such as polio. Biodiversity also continues to decline, and extreme climate conditions are becoming ever so common. The growing problem of air, soil, water contamination, and noise pollution are also a threat. Over 70% of our country's disease burden can be attributed to preventable environmental factors. This government is thus resolved to address these challenges in a multi-sectorial fashion through research and methodical and foresighted approach. Invited guests, ladies and gentlemen, as an avid promoter of health, I wish to challenge all you brilliant environmental health practitioners to start doing things differently. Let us drastically reduce on the cost of providing health services through preventive medicine, of which environmental health is a pillar. Preventing a disease is cheaper than treating a patient. As the adage goes, prevention is better than cure. I'm glad that the conference theme is repositioning environmental health in the implementation of strategic development goals in Zambia. This entails that we change the way we have been delivering environmental health services in order to cost effectively and efficiently achieve better health outcomes. To enhance our transformation scheme, this government, under the able leadership of His Excellency, the President of the Republic of Zambia, Mr. Hakainde Hichilema, has placed a high premium on issues of the environment. This has been evidenced by creating a dedicated ministry responsible for green economy and the environment. Because environmental health cuts across various ministries, let us therefore forge partnerships with ministries that are responsible for various response elements. These ministries would actually include the Water and Sanitation Ministry, Ministry of Agriculture, Ministry of Livestock and Fisheries, Ministry of Local Government and Rural Development and Local Authorities, Commercial Utilities, including statutory bodies. In order for there to be improvements in the environmental health, infrastructure, and living standards, we need real collaboration that must occur with all these institutions working across the different areas of health, social, and physical environments. Invited guests, ladies and gentlemen, let us also devote time to consider the goal One Health concept, to consider the global One Health concept, which fosters research and practice that places a priority on improving health and achieving equity in health for all people worldwide. And under this One Health concept, problems that transcend national borders like COVID-19 should also be addressed in a comprehensive manner. Thus, the Global One Health is about worldwide health improvement, reduction of disparities, and protection against global threats that disregard national borders. Invited guests, ladies and gentlemen, it is crucial that we ensure that our people have equal access to health services that they need to be actively involved in the design, delivery, and control of these services. Let us therefore develop a comprehensive long-term plan of action that is targeted to need, evidence-based, and capable of addressing the existing inequalities. Addressing these inequalities will lead to achieving equality of health status and life expectancy between all. We must also maybe look at ensuring primary health care services and health infrastructure for all. We should also ensure full participation of the community in all aspects of addressing their health needs. Let us therefore also work collectively to systematically address the social determinants that impact on achieving health equality for all. We should also ensure that health services are available, appropriate, accessible, affordable, and of good quality, and measure, monitor, and report on our joint efforts in accordance with the benchmarks and targets to ensure that we are progressively realizing our shared ambitions. We should work to enhance the relationships between people and the environment, promoting human health and well-being, and fosters healthy and safe communities. We should advance policies and programs to reduce chemical and other environmental exposures in the air, in water, soil, and food to protect people and provide communities with healthier environments. Invited guests, ladies and gentlemen, may I take this opportunity to thank the Zambia Institute of Environmental Health and the Lusaka Environmental Health University for successfully organizing this conference. I will tell you that when I got the invitation and I was told this was going to be the first visas I normally get, I told myself, this one I have to attend. Why? Because I am a true believer of environmental health. And having been a community leader at various levels in my entire public life, I know exactly the impact of your profession. I also know that in many ways, successful governments have underplayed your role. But I want to say this to you, you have a partner. Not just a partner in your minister, but a true partner in the president himself, who is a true believer of your role. And to underscore your role, this is why that for the first time, the policy of decentralization is seriously being addressed by implementing. And if you see the steps that His Excellency has taken, from day one, he had already decided that he was going to move resources to the district level, and hence the increase in the CDF fund. And I believe that your role is truly on the ground, and that the increase in the CDF will actually see more effort towards environmental health. I think what only remains is our realignment in terms of functions that should now all go to the district level. And to that extent, The good news is that this administration is very committed, is very determined to see that not only the functions are going to go to the district level, but the resources will follow. And the right skilled persons will also follow, which should also include yourselves. And the right numbers of environmental practitioners will also be employed. And you have seen already that even in our recruitment, in the 11,000 plus health workers, we have, in the first instance, allocated over 500, 600 environmental experts. We hope that going forward in the year 2023, we'll employ more so that we spend more time on preventive functions at the grassroots, so that we are not waiting for people to get sick and to be overspending, wasting resources on curative when we can prevent. And I think if we put our money correctly in terms of euro, I think Zambia will have a healthy nation with happy people. And I think that is our real desire, and one of our major goal, to ensure that we have a country that is not just clean, but also with healthy people. And I think you yourselves, as environmental health practitioners, has that major role to play. And I'm happy to note that at last we have now in Zambia a specialized university that is basically looking at environmental health, because even in the other universities, I took note that the subject of environmental health lies was just like one, by the way, courses, like they list all the courses. But now we have a fully fledged institution, which is the Zambia Institute of, the Lusaka Environmental Health University. And I take note that obviously, because it is specialized, even the quality of the program and everything that has to do with environmental health is really receiving more attention. And we are looking forward to getting quality students or graduates coming from that university. And we are there to partner with you. And we are very happy with what you have done today by setting up this conference. And my hope is that at the end of the conference, you come out with resolutions that you can present to the ministry, how or what you think, how best we can work together to improve our country in general. So thank you very much for the work. And